His therapy is practiced by many, many people today. I have patients doing his therapy, some with lymphoma and melanoma. I've had excellent results with that. And some with autoimmune diseases, I've seen complete cure. So yes, it is used very much today. Well, Dr. Gerson laid down the principles of dietary healing and detoxification. High potassium, low sodium, restricted but not deficient protein, low fat. When you apply those principles or that framework against an individual case, you can tailor, you can keep within the guidelines, but you can tailor the program to the case. So, for example, a person with cancer may want to follow the whole Gerson therapy, but a person who just has hormonal problems or arthritis may not need to do the full-blown therapy. So in my work, and I've been doing this for about 25 years, I've discovered how to apply those principles within an individual case. I will use, in my practice, I will use herbs, Chinese herbs in particular. Sometimes I will use a few supplements, but quite honestly, the core of the treatment is the diet. And I've had patients who've been so sick, but they've been too poor to afford any adjuncts, any herbs, any vitamins or minerals, and they have done fantastically well. I've had other patients who've sort of scraped by on the diet. They haven't been very compliant, but they've thought that they can make it up by using lots of supplements. They don't do as well. The magic is in the diet. Dr. Gerson didn't invent the principles of dietary healing, but he contributed enormously to the practice of it and our understanding. So he drew upon a lot of literature and a lot of dietary practice at that time, where it was known amongst a lot of the clinics that if you have a clean diet, if you go vegetarian, if you eat raw foods in terms of the raw vegetables, you would get this healing inflammation, you'd get a discharge of mucus. So all those principles were set down quite a long time before he developed his therapy. But what he did contribute was this understanding of the sodium-potassium relationship, the enormous quantity of vegetable juicing, the addition of the potassium salts to the juices, and most importantly, the use of the coffee enema in its role of facilitating detoxification. A lot of people don't know that patients, when they were put on his program, initially they could get worse just doing the juicing and the diet, because they were actually becoming poisoned by their own toxins. So the use of the coffee enema, which facilitated the elimination of the toxins, allowed the patient to start healing. So he really got his clues as to how desperately important proper detoxification was through patients really getting sicker on potentially a very good diet. I think Dr. Gerson is absolutely pivotal in the whole history of healing, and that probably within the next 50 years, just how pivotal he was will come into our understanding. I mean, a lot of people use aspects of his therapy. They'll use the juicing or the enemas, but they'll miss out certain parts of it. And I say that that's a bit like making a loaf of bread. You know, you say, oh, what's the main ingredients? You've got your flour and your water. Oh, and a bit of sugar and a bit of salt. So you bung it all together. Is anything going to happen? No, because you haven't put the yeast in. So the thing about the Gerson therapy isn't taking its component parts, it's how it's put together. And if you make sure that you put all the ingredients together because you understand their relevance and their importance, how they're going to fill the cells back with potassium, how they're going to ensure that ATP is made, then you've got your complete therapy and it's going to work for you. So that's the magic, is how he brought all the component parts together for this marvellous result. The Dr Gerson worked empirically, which means that it was observational medicine. So he would try the program and he would make adjustments to it. So he would monitor very, very closely, and he built the therapy. For example, I can't remember offhand, but he did about 300 experiments to try and get the right blend of potassium salts over a 2-year period, just to achieve a better outcome with the healing and the detoxification.